So rollator walker, for those that may not be familiar, is a four-wheeled walker. So instead of having two wheels on the front and either skis or tennis balls on the back, it has four wheels. They also come in the three-wheeled sizes as well. The difference between a rollator and a traditional two-wheeled walker is it's built for speed. So the wheels are more mobile, so you can turn corners a little bit faster. So there are advantages to that because it provides enough stability, but the downside of that is because it is built for speed. If you are someone who needs something a little sturdier, and that walker has the potential to get away from you, and then that potentially becomes a little bit of a fall risk. So rollators work well for people who are beginning to notice they need a little bit of assistance, but they don't need as much stability as a two-wheeled walker provides with the tennis balls on the back. One of the advantages of a rollator, and something that I know a lot of folks like, is that it has the bench seat. So if you find that you fatigue very easily, that you get tired when you're out and about, what a lot of people appreciate about the rollator is that they can lock the brakes, make sure you lock the brakes, turn around, and then it's a seat for them. So perhaps if you have some cardiac issues or some pulmonary issues on top of your other arthritis issues, and you find that you don't have as much endurance and that you're limited, that rollator does provide a seat wherever you are for you to safely sit and take a break. Did you want to add anything in, Dr. Curry?
I was just going to add the inappropriate ways to use a rollator are to have somebody sit down on it and to push them as if they were in it on a stroller. Unfortunately, I've seen patients go over because the front wheels of a rollator swivel. And so if you hit a bump with that swivel wheel, the wheels turn and it will throw the patient off. So you should never have somebody sit on it facing you and pushing them on it. That's inappropriate. The second thing I would say is posture. We've talked a lot about posture, and posture is really important. So make sure that the handles of a rollator are high enough that someone can stand up. If someone has to bend over to use a rollator, then you're only facilitating bad posture. So it's always better to have the handles so that your elbows are bent about 30 degrees, because then you're going to be able to stand up further. If you've got to bend over, and lean on a rollator, then a rollator may not be the best device for you. You may need to switch to a two-wheel walker for a little bit more stability. So it's just something to think about in terms of safety.